Laso is a mobile application. It's built to be simple, friendly, and powerful, but what it does is for people seeking healthcare services, it gives them upfront, transparent pricing, convenient booking through the app, and then direct access to specialists and other physicians without the need for pre-authorization referrals. In that sense, it's kind of like an Uber and a Travelocity and a Groupon all together. Laso is the vision of Dr. Mazzani. One day while booking a trip, he thought to himself, I can book a trip around the world through my phone, but I can't do that with healthcare. That sparked the idea for Laso.
You know, why Laso? Because we believe that everyone should have access to healthcare when they want it and not deal with the bills or surprise bills when they don't. I can think of countless examples where I've been hit with a bill on the flip side of paying for what I thought was my healthcare.
Realizing how pervasive the problem of medical debt in this country, the accessibility, health equity, all these things that we're looking to solve with Laso, that's exciting. That gets me up every day. I mean, we're literally creating an alternative healthcare system with this app.
The reason why we're so different is that we're focused truly on the patient and on the end result, and that is we're committed to the values that we and the tenets that we really have talked about from the beginning, and that's our rail. We've allowed ourselves to view healthcare as a synonymous word for health insurance. So the U.S., we have health insurance. We haven't really refined, if you will, healthcare. And I think direct access healthcare was really the answer to that. And through a web-based smartphone application, Dr. Mazzani really just had a great vision for what this eventually became in Laso Health and the app.
It is pretty amazing that at this point in time, you can have an app connected to your phone that talks to your watch, that's reading your vital signs and predicting you're going to get sick before you even have symptoms. I think healthcare it's wide open for where healthcare can go with technology.